Does Bristol Myers make a profit selling Eliquis for $900 a year in Canada?
Senator, we do make a profit.
All right, so you're selling the product for 13% of what in Canada, of what we pay in the United States, and obviously you sell it there because you make money. So, Mr. Berner, will you commit today that Bristol Myers Squibb will reduce the list price of Eliquis in the United States to the price that you charge in Canada where you make a profit?
Senator, we can't make that commitment.
Of course they won't make that commitment because they like making a profit, but they love making a really big profit. But I am glad that Bernie Sanders is using his time where they are talking with the heads of 3 of these big pharma companies to point out how insane the pricing is between different countries. As he points out, they can sell for 13% of what they sell in the United States, this drug, and they make a profit off of it. Their business would grow, their stock would go up. They would be able to exist as a company and people would have access to this drug. But because things have been set up, rigged in a way that there's much less negotiation. A lot of the suppliers of health insurance they're not going to try to buy generic versions or drugs from outside the United States. They're allowed to artificially hyperinflate their profit margins here. And of course, they're not gonna just change that because you pointed out in a hearing, but I love that Bernie's doing it. That is what we love Bernie for. That is what actually being opposed to the economic status quo and the elites who benefit from it look like. Not Tucker Carlson making a reference to Jewish billionaires or something, but taking a look at those who have set up the system so that they will always win and challenging it, asking why it needs to be that way when the system as it's set up in our literal nearest neighbors is far more equitable and they would still make a profit under it. And so we have more of this, but Brett, what do you think?
Yeah, that's the argument, is that they don't want to make money. That's what the guy's saying. He's like, I don't want to make money. Sorry, I don't want to just make money. I want to make lots of money. I want to make all the money. And you know who I want to make it off of? People with AFib. Americans with AFib. I think you could get a lot of, first of all, you have a lot of people on your side with this. Like, this isn't like we need to really change the messaging to win over Trumpers. Like, Trumpers are on your side with this. And the reason that what ends up happening is Trumpers get less jazzed about it when you say what is necessary to get the prices that you have in other countries. What you need to do is create systemic change, and people just don't like that. It's very scary. But I would think that someone like Trump would be great at this. I think Trump would be great at messaging what's missing, because what's missing from our system is negotiation. And Trump literally, quote, wrote the book on that. We're not, so those other countries are able to say like, all right, we have the national healthcare system. We're gonna buy a lot of your drug. If the price is right, we're gonna Costco wholesale this thing, as opposed to what we have, which is every little separate drug company and little, Blue Cross, Blue Shield, Aetna, Kaiser, they're all doing their own mini negotiations. Trump could have said like, you know what, I'm gonna go through and I'm gonna tell you guys we're not buying any Eliquis. We're going generic out of India unless you lower the price.
Yeah, 100%.
And that just, we're not allowed to do that.
Oh, exactly.
And
by
drugs
the
by
way, to
2029.
make clear, this hearing is about the fact that finally, at long last, they set up for Medicare negotiations for a very small select list of medications. Now, they are medications that make up a significant chunk of the expenditures from Medicare. I believe it's 20% of Medicare Part D spending is these 10 drugs. That's what we finally got, was this limited number of drugs. And those companies are trying to kill that. And the Republicans want to kill that. If you're a conservative and you're watching this, I understand that you've been trained to think that companies are like, simultaneously, we're populist, we're anti-elitist, and companies are the best thing ever and they should never be constrained in any way. But they are screwing you over and the Republicans are giving them a major assist. It does not have to be this way. You do not have to suffer spending a massive percentage of your take-home pay on necessary medications that are far cheaper in other parts of the world. And not just in Canada. It's not just like Canada somehow magically set up a system where it works way better for them. Those 10 drugs that are currently now, thankfully, able to be negotiated for a limited period of time are on average 3 times more expensive in the US than in other advanced countries. Ask yourself why. Ask yourself, if we were able to, like they have that Apple Vision Pro, cool technology, and you can like augment reality or whatever. If we had that hearing playing and you could project above each of the senators there how much they've gotten from big pharma through the course of their career, what do you think those numbers would look like? And that's why they make tons of money off of these drugs. They take a tiny portion of it and they use that to buy the politicians to make sure that there are never any new regulations on them. That is actual corruption. And thankfully, there are a few people like Bernie Sanders who are fighting against it.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.